Hi everybody. So I had a couple of people ask me about the duplicate denture, reference denture technique, and I decided to make this video to explain things a little bit better clinically for what we need to do in order to get this accomplished. A lot of times patients will show up when they have a set of dentures. Now, sometimes that set of dentures is not the best, the occlusion's all over the place, but the bases are still fitting somewhat okay in the area that we are working with. Now, you can use that duplicate denture at that point to take a reline impression with the duplicate dentures. And if the bite is correct, you can also take the bite, okay? And from there, you will send it to the lab, and the lab will fabricate new models, new base plates, and they'll do a setup based on this relationship. So important things to consider. If your patient shows up and they're skeletally class 1, for example, but you could see that they worn down their posterior occlusion so much that they're now in prognathic class 3. Now, you can't redo dentures in that position because you're going to capture incorrect centric relation. So at that point, you're going to be treating your dentures just basically like custom trays. So like with any custom tray or with any reline impression, what you basically need to do is you need to check for overextensions. And the way I usually do that is I'll use ultralight viscosity impression material, or ultralight body, you can call it that as well. And I will use that as a fit checker, and I'll put it on the borders, put it in the patient's mouth, have them bite down, go through all the movements and everything else, and I'll check for overextensions. Because basically with dentures, right, over time, patients will have a resorption of their residual ridge, but the dentures themselves don't resorb on that area. So the dentures will naturally become overextended. So before taking a reline impression, you will need to reduce those overextensions. Once you reduce those overextensions on both maxilla and mandible, what you need to do is you need to pick a denture that's the least stable one. It's usually the mandibular one. What I will basically do is I'll trim all the borders and everything else, and then I'll make sure I apply adhesive. Adhesive is a very important step. I see very often clinicians forget to place adhesive when doing reline impressions. It creates a lot of issues on the laboratory side. So once you've applied adhesive, you will apply, generally, if the denture is not horribly loose, I will use ultralight viscosity impression material because it just does not have to fill in a lot of space, let's put it that way. But if the denture is looser than normal, then I would probably use light body. Okay, for that. And the important step when you're taking that impression, you have to make sure that your patient is in occlusion. Because if your patient is not in occlusion, you're not going to capture the proper, first of all, not proper vertical, because you're probably going to have things open way too much, and also you're not capturing the proper centric relation. So you won't be able to go to the step, from this step to the step of setting up teeth. So you might be able just to use it as a custom tray. So you put that in, have the patient bite down in occlusion, and generally before the patient bites down, I usually hold it with my fingers and have the patient do the tongue movements first, then have them bite down, and then we'll do a little facial massage and pulling, and have the patient go O-E to get just a proper border molding of everything else. So once you've done the lower impression, remember you have adhesive, you have your impression material, and you have to make sure it's in occlusion, okay? Once you do that, you take it out, you inspect it, make sure everything's impressed well. If you have some overextensions with impression material, go ahead and cut them back. Finish that, put it back in the patient's mouth, okay? Then you take your upper and do the same thing. Once everything's been reduced where it needs to be, you put adhesive on there, either use ultralight body or light body, and make sure you're in occlusion, okay? Once you've done that, take out the upper, make sure you inspect everything, make sure everything's good, you're good to go. Nice. You have your upper and your lower impressions, okay? At this point, if you have a horrible bite and you have to start from wax rims, no problem. We're just going to send it to the lab, pour that up, and we're going to fabricate something like this, which is a Gothic arch tracer, right? We're going to come back and we're going to use that to determine our patient-centric relation and their vertical as well, okay? But if our occlusal relationship is good, we're going to capture that bite after we took those impressions, okay, and send that to the lab. What the lab will basically do is they'll pour up the case, and they'll make some new base plates, and they'll set teeth according to that relation. Now, if you have issues with your midline, if you have issues with the length of your anteriors, you need to relate that to the laboratory. So basically, if you have a midline problem, mark with a Sharpie on the duplicate denture how far you want the midline switched. Also let the lab know, do we want to go with the same shape and size of teeth, or do you want to go smaller, or do you want to go bigger? Is the length okay, or do you want it longer or shorter? Now, if you want it longer, you need to say, please add 1 or 2 millimeters to the incisal edge. If you want it shorter, just mark with a Sharpie how short you want it. So things like that. If your patient's case is canted, for example, what you need to do is you need to send some kind of horizontal plane. You can do that with either a phase bow, which is a little bit of an overkill in my opinion for something like this. You can use a Cois analyzer, or if you don't have any of those, you can just do a stick bite. So basically what stick bite is, you just take a Q-tip, a long Q-tip, hopefully it's going to be straight, right? And you put a little bit of bite registration material in the front. That's not the same as a regular bite you're going to be taking with this. It's going to be a separate. So you're going to put a little bit of bite registration material in the front, have the patient bite down, and then you're just going to slide that into that bite registration, and then you align it into the interpupillary line. And thus should be good enough with all those other records to send in to lab and tell them, you know, we took patients' duplicate dentures, we did final impressions, provided new midline, new length, provided a stick bite as well as a regular bite. Please, from this point, fabricate new models, new base plates, and new setups according to those records and send it for a try-in. So this way, you're skipping your initial impression appointment. You don't have to make custom trays because those are made already for you. So you go, and in that one appointment, you will do your final impression and your bite registration, hopefully. So you'll get to skip wax rims and go straight to try-in at that time. Okay? Hope that makes sense. I might have missed a couple of little things. But if you have any questions, please let me know, and I'll try to help you as much as I can. Thanks for watching. Bye.